Hey, future nurses. Huge congrats on hitting week 7. I hear oncology's on deck, and that's a huge EE milestone. So we're here to help you conquer this. Tough, but crucial topic. Think of this deep dive as your secret weapon, breaking down your course materials, adding some pro tips, and even demystifying the science behind cancer.
We're going beyond just memorizing facts here. We're about understanding the why behind the what, so you can provide truly excellent patient care.
All right, let's tackle that scary-sounding definition of cancer from your textbook. A broad range of diseases that can arise in any cell, evading regulatory controls. Even I'm intimidated.
Don't worry, we'll unpack it. The key is that cancer cells forget their jobs and go rogue. Two things happen. Uncontrolled growth, they multiply like crazy, and loss of differentiation. They stop acting like normal, specialized cells.
So it's like they're playing a cellular game of telephone,
Oh,
where the message gets totally garbled along the way.
exactly. And this garbled message leads to cells growing without purpose, crowding out healthy tissue. That's why those caution signs are so important. Change in bowel or bladder habits, a sore that doesn't heal, unusual bleeding, thickening lump, indigestion or difficulty swallowing, obvious change in a wart or mole, nagging cough or hoarseness.
As future nurses, you're going to be the first line of defense. Noticing these subtle changes and advocating for your patients, early detection can make a world of difference. Speaking of early stages, our sources describe how cancer develops in 3 key steps: initiation, promotion, and progression.
Think of it like a recipe for disaster. Initiation is like adding the first ingredient, a DNA mutation that damages a cell. Then comes promotion, like turning up the heat, where things that further damage DNA, like smoking or UV radiation, speed up the process.
And finally, progression's where things really get cooking, with mutated cells growing out of control and potentially spreading or metastasizing to other parts of the body.
It's a bit like a wildfire, starting small but quickly spreading if not contained. Early detection is key to putting out those flames before they get out of control.
And here's where it gets really fascinating. Those sneaky cancer cells can actually disguise themselves to evade our immune system's defenses. Talk about a cellular-level game of hide-and-seek.
It's true. Our sources talk about these tumor-associated antigens that essentially act as camouflage, helping cancer cells blend in and avoid detection by our immune system's soldiers.
So our own body sometimes can't recognize these rogue cells. That's mind-blowing. But thankfully, doctors have ways of tracking them down, like using oncofetal antigens as clues.
Right, exactly. These antigens are like fingerprints left at a crime scene.
Right.
Detecting them, doctors can identify the type of cancer and track its progress.
Okay, so we've got these rogue cells running amok.
Yeah.
But how do we actually classify the different types of cancer? It's not a one-size-fits-all situation, is it?
Not at all. Our sources explain how the TNM staging system is used to determine the extent of the disease, kind of like a detective gathering evidence to understand the scope of a crime. T refers to the size of the tumor, N to whether it has spread to nearby lymph nodes, and M to whether it has metastasized to distant organs.
So the higher the stage,
Yeah.
the more serious the situation. Kind of like a video game, where higher levels mean tougher enemies.
You got it. Higher stages generally indicate a more advanced and potentially aggressive cancer. But remember, every patient is different, and staging helps guide personalized treatment plans.
So let's shift gears and talk about prevention. Is there anything we can do to lower our chances of getting cancer in the first place? Or is it all just a roll of the dice?
While there are some risk factors we can't control, like genetics, our sources emphasize that lifestyle choices play a huge role. Think of it this way. You're giving your cells the tools they need to stay healthy and fight off those rogue agents.
So it's all about building a strong cellular defense force. What kind of weapons are we talking about?
Our sources highlight the importance of a diet rich in fruits, vegetables, and whole grains, like fueling your body with premium, high-octane fuel instead of junk food.
And limiting alcohol and saying no to tobacco are like cutting off the enemy's supply lines.
Right? Exactly. And don't underestimate the power of regular screenings and checkups. Remember those caution warning signs we talked about earlier? Early detection is like having a surveillance system in place, catching those rogue cells before they have a chance to wreak havoc.
It's amazing how much power we have to influence our own health.
Wow.
Let's get into the nitty-gritty of treatment. Our sources mention a whole arsenal of options: surgery, chemotherapy, radiation therapy, immunotherapy, targeted therapy, and even hormone therapy.
That's right. And each approach has its own strengths and weaknesses. The choice of treatment really depends on the specific type of cancer, the stage, and the individual patient's needs.
So it's like having a toolbox full of different tools. You have to choose the right one for the job.
Exactly. Surgery is like going in and directly removing the enemy forces. Chemotherapy is like disrupting their supply lines by targeting rapidly dividing cells.
And radiation therapy is like using precision bombing to target specific areas where cancer cells are hiding. It's incredible how far medical science has come.
It
Right.
really is. Now, let's not forget about the newer approaches like immunotherapy and targeted therapy. Immunotherapy is like rallying your body's own troops to fight the cancer cells.
And targeted therapy is like sending in special forces to attack specific vulnerabilities in the cancer cells.
Yeah.
It's like having a team of elite snipers taking out the enemy's command center.
Those are great analogies. And just like with any powerful weapon, these treatments can come with side effects. Our sources mentioned myelosuppression, fatigue, and gastrointestinal issues as some of the common challenges patients may face.
That's like the body going through a major battle and needing time to recover and rebuild.
Exactly. And that's where supportive care becomes absolutely crucial. As future nurses, you'll play a vital role in helping patients manage these side effects and maintain their quality of life throughout their treatment journey.
Speaking of supportive care, let's bring in our special guest expert, Dr. Sarah Jones, a renowned oncologist who can shed some light on this vital aspect of cancer care.
Yeah.
Dr. Jones, welcome to the Deep Dive. We've been talking about the challenges patients face during treatment, especially those pesky side effects. Can you tell us a little bit about how healthcare teams approach supportive care and how nurses like our listeners here can make a real difference?
It's a pleasure to be here. You've hit the nail on the head. Supportive care is not just an add-on. It's woven into every step of a patient's cancer journey.
Our listeners, those future nursing superheroes, will be right on the front lines of that care.
Absolutely. Think of it as a holistic approach. We're managing not just the disease itself,
Right.
but the impact it has on a person's physical, emotional, and even social well-being.
So it's not just about treating the tumor, it's about treating the person.
Exactly. Nurses are often the ones who really get to know the patient, their fears, their needs, their support system. You pick up on subtle cues that might be missed otherwise.
That makes so much sense.
Mm-hmm.
Now, we touched on side effects earlier. Our listeners are diving deep into pharmacology right now. So what are some key meds they should be ready to see in action?
Well, nausea and vomiting are incredibly common with chemotherapy. That's where antiemetics like ondansetron and granisetron come in.
Ondansetron, that rings a bell. Isn't it available in different forms?
You're right. It comes as a tablet, oral solution, even a patch, which can be great for patients struggling to keep meds down. Granisetron is typically IV. Both work by blocking those pesky serotonin receptors that trigger nausea.
Future nurses, take note. Now, what about diarrhea? Another frequent flyer on the chemo side effect list.
Loperamide is often the go-to. It slows down gut motility, giving things a chance to, well, firm up. But always be vigilant for constipation, especially with long-term use.
So nurses are like detectives, constantly monitoring and adjusting based on the patient's response.
You said it. Now, chemo also throws a wrench into blood cell production. That's myelosuppression. And it leads to anemia, fatigue, and increased risk of infections.
That sounds serious. What's
Yeah.
our arsenal for combating that?
First up, we have erythropoiesis-stimulating agents like epinephrine alpha. These boost red blood cell production, helping with that energy drain.
So it's like giving those tired red blood cells a much-needed caffeine boost.
Perfect analogy. And to bolster those crucial white blood cells,
Yeah.
the infection fighters, we have colony-stimulating factors like filgrastim and pegfilgrastim.
Wow. It's like a whole pharmacy in one. But I'm guessing there's even more to supportive care than just meds.
Absolutely. We also address pain, nutritional needs, emotional distress, and even practical concerns like transportation or financial assistance. It truly takes a village.
And nurses are the heart of that village, coordinating care and making sure the patient feels heard and supported.
Couldn't have said it better myself. It's about treating the whole person, not just the disease.
Dr. Jones, this has been incredibly insightful. Thank you so much for sharing your expertise with our future nurses.
My pleasure. Remember, nursing students, your compassion and knowledge are powerful tools. Keep asking questions, keep advocating for your patients, and never underestimate the impact you can make.
That's inspiring stuff. Now, going back to our deep dive, let's talk about pain management in oncology. Our sources emphasize this as a critical area where nurses can truly shine.
Absolutely. Cancer pain can be complex. It can be acute or chronic, stemming from the tumor itself, treatments, or other underlying conditions. It's not as simple as just giving a painkiller.
So how do nurses approach this kind of multifaceted challenge?
It starts with meticulous assessment. What's the nature of the pain? Where is it located? How severe is it? What makes it better or worse?
Sounds like detective work again.
It is. Once we had a clear picture, we can develop an individualized pain management plan. This might involve non-opioid analgesics like acetaminophen or ibuprofen for mild to moderate pain.
And for more severe pain, opioids like morphine or oxycodone might be necessary.
Exactly. But we always weigh the benefits against the risks, especially with long-term opioid use. And don't forget adjuvant therapies. Antidepressants or anticonvulsants can be surprisingly effective for certain types of pain, especially nerve pain.
It's amazing how interconnected everything is. So it's like a
Right.
puzzle, finding the right combination of pieces to achieve optimal pain relief.
You're getting it. And remember, pain is subjective. What matters most is the patient's perception and how it's impacting their quality of life.
So nurses are advocates,
Yeah.
ensuring their patients' voices are heard and their pain is taken seriously.
Precisely. It's about compassion, empathy, and a commitment to providing the best possible care. Now, let's shift gears and talk about another crucial aspect of oncology nursing, addressing the emotional and psychosocial needs of patients.
This is where those amazing interpersonal skills come in.
Right.
Because cancer isn't just a physical battle, it's an emotional roller coaster.
Exactly. Our sources talk about the importance of recognizing and validating patients' feelings of fear, anxiety, sadness, anger, all of it. It's a normal response to a life-altering diagnosis.
So nurses are like emotional first responders,
Hmm.
providing a safe space for patients to express themselves.
That's a great way to put it. Sometimes just listening without judgment can be the most powerful intervention.
And it's not just about the patient.
Yeah,
Families are often going through their own struggles, feeling overwhelmed and helpless.
absolutely. Nurses can play a crucial role in supporting families, providing education, resources, and a shoulder to cry on.
It's all about recognizing that cancer affects the entire family unit,
Hmm.
not just the individual.
Exactly. Now, let's talk about a topic that often gets overlooked, the long-term effects of cancer treatment. Even after treatment ends, patients can experience lingering consequences.
I mean, like those late effects we mentioned earlier.
That's right. These can range from physical problems like fatigue, heart problems, infertility,
Yeah.
to cognitive difficulties, emotional distress, and even financial burdens.
Wow. Like the impact of cancer can cast a long shadow.
It can, but knowledge is power. By educating patients about potential late effects, we empower them to be proactive about their health.
So nurses are like guides, helping patients navigate the often complex world of survivorship care.
Exactly. We encourage patients to report any new symptoms,
Yeah.
attend follow-up appointments, and connect with support groups or resources that can address their specific needs.
It's amazing how much responsibility nurses shoulder and how much impact they have on patients' lives.
It's a privilege and a challenge, and one that our future nurses are more than capable of handling. Remember, you're entering a field where you can make a real difference.
It's incredible to think about the breadth of knowledge nurses need to have. You're not just dealing with medications and procedures, you're dealing with people's hopes and fears.
That's why it's so important to remember that the field of oncology is constantly evolving. What we know about cancer today might be different tomorrow. New treatments, new research, new breakthroughs are happening all the time.
So our listeners can't just stop learning after graduation. They need to stay curious, stay updated.
Absolutely. Never stop asking questions. Attending conferences,
Yeah.
reading journals, connecting with colleagues. The learning never ends.
It's like you're all lifelong students, which is kind of exciting.
Right. It is. It keeps things fresh and challenging. And honestly, it's what makes nursing such a rewarding profession. You're constantly growing and making a difference in people's lives.
Speaking of making a difference, let's bring this back to our nursing students tackling oncology this week. What's one piece of advice, one key takeaway they should hold on to as they dive into this challenging field?
I'd say, remember the power of human connection.
Yes.
You need to master the science, the pharmacology, the procedures, but never lose sight of the person behind the diagnosis.
So it's about treating the whole person, not just the disease.
Exactly. Listen to your patients. Validate their feelings. Offer a kind word, a gentle touch, sometimes. Those simple acts of compassion can be the most powerful medicine of all.
It's a reminder that nursing is both an art and a science, blending technical skills with genuine human connection.
Couldn't have said it better myself. And remember, nursing students, you've got this. You have the strength, the compassion, and the intelligence to excel in this field.
And we, along with all your instructors and mentors, are cheering you on every step of the way. So keep learning, keep caring, and never underestimate the impact you're going to have on the lives of your patients.
It's been a privilege sharing this deep dive with you all.
To our incredible nursing student listeners,
Yeah.
as you face the challenges of oncology this week and in your future careers, remember this. You have the knowledge, the compassion, and the strength to make a real difference in the fight against cancer. Keep learning, keep caring, and never give up hope. And you know what? It's not always about having all the answers. Sometimes it's about being present, being a source of support, and just letting your patients know that you're there for them, no matter what.
I think that's such an important point. As healthcare providers, we often feel like we need to have all the answers.
Mm-hmm.
But sometimes the most powerful thing we can do is just be there, to listen, to empathize, and to offer a sense of hope.
Absolutely. And I think that's something that all of our nursing students out there can take to heart. As you embark on your careers, remember that you have the power to make a real difference in the lives of your patients, not just through your clinical skills, but also through your compassion, your empathy, and your willingness to simply be present.
And on that note, I want to thank you all for joining us for this deep dive into the world of oncology. It's been a pleasure sharing our insights with you.
And to all our future nurses out there, keep up the amazing work. You're going to be incredible. That's it for this week's deep dive. We'll catch you next time.